Hi, I'm Viv Tipton, Executive Director at Hospice of the Foothills. We're here today for Breaking Down the Barrier, talking about death and dying. I've got three dear friends and experts with me today. Lauren Swinney, who is the manager of the ATC and palliative care at Sierra Nevada Memorial Hospital. Gregory Ingram, chaplain and spiritual care counselor at Hospice of the Foothills. And Mary Lou Falstro, a local renowned artist who also helps facilitate programs for grieving. Well, let's get started by just getting the audience acquainted with each of you. Can you share a bit about who you are and what brought you here today? I'm going to start with you, Lauren.
So I'm Lauren Swinney. I've been in the area for 39 years. I've worked at Sierra Nevada for 38. I've worked in various departments, medical, surgical, telemetry. Currently, I'm the manager of palliative care and the infusion center at Sierra Nevada. One thing about me that was truly a gift in my nursing life was that I was given an opportunity in 1990 to work at Hospice of the Foothills. And I worked there for a couple of years as a per diem nurse, and it absolutely changed my direction in nursing.
Awesome.
So,
awesome.
Thank you for inviting me.
Yeah. What about you, Gregory?
Yes, Gregory Ingram. I am, as you said, the spiritual care counselor at Hospice of the Foothills, and I've been here for about a year and a half now, and I am new to the area and have fallen just in love with this area. My background is I did a graduate degree in theology and religion when I was quite younger, and part of that program was the requirement to do an internship. And I had been overseas and didn't get back in time, and the only internships that were left in this program were hospice internships. And I reluctantly took the hospice internship, and it turned out to be one of the most beautiful things I had done in my life to that point. And after graduation, I just kind of targeted my life towards hopefully getting into being a full-time hospice spiritual caregiver, and was able to do that about 10 years ago, and have been doing this sort of work for about 10 years now, working with folks that are in the more advanced stages of illness, and preparing them and talking with them and being with them and journeying with them through the end-of-life process, and supporting their families as well.
That's awesome. It's awesome. And Mary Lou, share a little bit about what brought you here today and who you are.
What brought me here was that my husband became a recipient of the wonderful hospice care. It'll be 4 years ago in October that he passed away. And obviously the experience of his passing changed my life, but my most recent connection with hospice is changing my life too. I am an artist, a poet, a workshop leader. I've been creating tools for healing and transformation without even knowing it, probably since I was a little girl. I'm empathetic, sensitive, take on the world's pain. I laugh, and it really is not a good thing. But I have a series of art called the Women in the Hourglass series, and that began it was in 2009. And it was as a result of my son's struggle with addiction. And now the tool, there are 72 images, is being used with hospice, with people who are struggling with substance abuse, domestic violence, homelessness. And I'm just incredibly grateful to be able to help.
Awesome. Thank you. Why do you guys feel it's important for folks to talk about death? I'm sure you get the question. I've gotten the question. Why do you think it matters?
Oh my gosh. Well, I'll start. It is, 100% is going to happen to all of us. And I think that the preparation And having those discussions is so important. I've started talking when my boys started driving. I had conversations about end of life, especially related to their lack of experience in driving. And I think that I was married to a man that was 20 years older than me. He has died in the last 2 years and was also a recipient of hospice. But it was something that we always talked about as just a life experience. I think that talking with families and patients about how they want to live whatever time they have left, especially if they have a chronic disease, possibly a life-ending diagnosis. It is important to have that conversation so all of these difficult decisions are not made quickly, and sometimes the time is not there for important family conversations and experiences.
You know, I could not agree with you more. I remember you years ago when I first started over at hospice sharing that story about talking to your sons. And I had not talked to my adult son about what his wishes might want to be. And I thought, wow, you probably need to do that. And so I did. And it's always awkward at first, right? But the more you talk about it, the more natural it became. So we were talking about it, and it struck me, I would have gotten it wrong. If something would have happened to him, I would have made the wrong decision. I'm very close with my son, but I had it wrong. And it was just that was a powerful moment for me of realizing, not just theoretically is it important to have these conversations, but quite practically it's important.
Exactly.
My feeling is the conversation should begin from the beginning with small children, and it should be a part of life. No different than a new baby coming into the world or wedding, a commitment to someone. I have two small grandchildren, 2 and 4, and we have talked about Grandpa Allen since the beginning. And we've had so many questions when we go for walks, or I've answered so many questions. When leaves start falling off the trees, we talk about dying and how old people get kind of crinkly and dry, and then they fall. And it's a way for them to understand. And the reason why I bring this up is when my husband, Alan, started going through the dying process, he was so unprepared and really didn't want to talk about it. And so it's become my commitment to make it just a natural part of life, the dying process. It's just what it is. It is. It's true for all of us.
Definitely. I think it's so important as we're able to be open to the conversations. I think they're terrifically important. And it unfolds so naturally for some families. I'm thinking of a recent family in the last maybe 5 hours of this gentleman's life. He had over 30 family members come in to be with him of all ages. And I just think about, and I compare that to my family. I remember going to my grandmother's when they were having a family vigil for grandma. And I was a little guy. I was like 9. And I remember, we were prepared. I remember my mom and dad saying, hey, you need to go in and say goodbye to, and there was a little push. I was scared, and they said, it's time to say goodbye to grandma. And I mean, I can sit here feeling the emotions well up. It was a beautiful, special, wonderful thing. And my little brain at, 9 or 10 or whatever it was, said, oh, this is what happens. This is the natural process. This is something we're all going to experience someday. So in those contexts, it just naturally unfolds. But for other families that maybe are further removed from that kind of intimacy with it, it can be so valuable to talk about on two levels, the emotional, internal, spiritual, but also the super practical. What do we want? Why would we do an advance directive? Oh my goodness, there's a ton of reasons to have an advance directive, and to tell your loved ones what you're looking for and want.
I found as my family has gone through a series of deaths, that the conversations that took place as with my brother or my father, as they were talking about what was important to them, it brought us closer. It allowed us an insight into a deeper part of them that, for whatever reason, whether it's the rush of life or the busyness of what we do, wasn't accessible before. And it allowed for a much more smooth when it came time for them to pass away. And so every one of those conversations, as you were talking, Gregory, I was just reflecting on that and going, yeah, it's those emotional pieces where we all knew what they wanted and we all got to go a little bit deeper, which sometimes our lives don't allow.
It is truly a gift. When we've had in the hospital setting, if the patient indeed is it looks like they are not going to be able to make it home with hospice, or things are moving fast. It is truly not only a gift for the nurses that are taking and the palliative care team, but for the family, those last words, the last memories, it is really something that you can never predict. But when that scenario is unified, that is a blessing. And I think that having those pre-conversations, knowing exactly what your wishes are, providing comfort is really that is so important. That your soul, this person is leaving our earth, and they've closed their chapter of their life. It is really an amazing experience that is truly a privilege to witness.
It's an opportunity. It's an incredible opportunity, I think. And I so agree with what you were saying, Gregory, because I'm just an open book. I talk about anything that comes into my brain. And I have learned that people are really uncomfortable with this subject. And so meeting people where they are, I think, is important. But it takes a certain amount of composure and self-restraint if part of the family is really wanting to talk about things and the rest of the family really doesn't want to go there. So it's an interesting opportunity for things to shift in families and in relationships, and showing up for it, I think, is really important.
So what's something that might surprise people about end-of-life journeys from your experiences? There's a lot of fear. I've noticed that people, or denial. I think denial is probably the better, it's like, oh, it's just not going to happen. But behind that is usually because people don't know what it is. But what has been surprising?
Well, I can speak to that because it's fresh in my mind. The challenge we had with Alan's passing was that he had dementia as well as terminal agitation. So I needed to repeat things to him over and over again. And then, and when the agitation happened, there was a complete loss of any meaningful conversation. And so what surprised me about that period of time, because he was a very peaceful human being, is that the end of his life wasn't as peaceful as I imagined it would be. But there was a moment of clarity where he looked at me. I can picture him. He was sitting on his walker by his hospice bed, and he looked me in the eye and he said, "So is this it?" And I said, "Yeah, this is it." And it was like the moment where he really got it. So I have that. I know that in that moment he got it. So I think that was the biggest surprise as a caregiver, is it was pretty intense, and for all of us, for he and I in particular, because we spent the most time together during the last moments of his life. So
Goodness.
goodness, it was
Yeah.
beautiful. Oh my
Yes.
goodness, changed my life.
Yeah. I'm obviously.
Yeah. I'm grateful for it. Yeah.
When you told that story, I was going to say something else, but it just made me think the incredible beauty that came out of that moment. I when I was a young man and in school and had to do that chaplain hospice internship, I was so scared. That's why I didn't want to do it. I was so scared. And I fell in love with the work, but I remember specifically this one lady. I came in with all these assumptions and beliefs, and I came into was asked to visit this one lady, and she was this skinny little lady in her bed, and breathing issues and COPD, all sorts of stuff going on pulmonary wise. And she insisted on having the cat was probably 12 plus pounds. And she loved her cat. The cat sat square on the middle of her chest. And I remember sitting and thinking, how are we doing this? And she insisted that's where she wanted her cat. And she had control of her life up to the very last moment. And you have these conversations, and I always let the person I'm with lead the conversation. And she said a couple of things, and then she looked at me, and she had been very directly talking about death, and she said, "Nobody really believes me, but I'm going to say it anyway. Gregory, I'm excited about what comes next." And I mean, boy, I threw a lot of assumptions out the door that moment. She was. And it was so beautiful for me, as I was like maybe 25, as a young man, to have that imparted to me. Oh my goodness, of course, there can be many, many factors going on, but this person in this moment is truly excited. And I just never conceived of that being possible. So, boy, that was a special moment.
I love that. It's like, I wish folks could see. I have this huge smile on my face. That surprised me. That's awesome.
I would say the same. I mean, both of your stories touch me, because I would say that in my experience with my husband, and I've cared for thousands of patients that have died, but what surprised me is that I think that he wanted to protect me up until the end, and never told me, never shared his feelings, never really talked about dying. Was at home, had some dementia also, but he told my son that his mom was waiting for him in heaven, and didn't tell me. And so, sorry, but I think that gave me peace, that he knew that she was waiting. The other thing that that Gregory, that you had said, that really holds true, is that I think that when we talk to people and have them start talking about dying and preparing, whether that's advanced directives or the 5 wishes tool, where they are telling us how they want this experience to play out, I think that it provides them so much peace that many times I have had people that they know where they're going, whatever their belief is, and having that peace provides them an opportunity to just let go. I mean, so many times, part of my role in nursing, in my nursing life, has been to administer chemotherapy. And years ago, we did not have the medications that we have now. Amazing medications that are saving lives. And patients, I would see them at the beginning of their treatment, and then I would see them at the end. And that transition went from fighting this terrible disease to accepting. And watching that transition was amazing. And it taught me, as a young nurse, taught me a lot. But I believe that having those deep conversations and the opportunity to talk about their fears really will provide them the potential for a more peaceful death and exit from our life. But thank you. Sorry, I was
No, it's beautiful.
caught in the moment.
It's again, it's that mix of the emotional and the practicality. I know with my brother, it was really important to him for surf music, so every member of our family throughout his treatment and his death had surf music on our phones because we weren't quite sure who was going to be with him at the time. And from a surprise perspective, I'm constantly surprised. I have the great privilege of being able to sit in what's called our interdisciplinary team meeting each week, where we talk about the different families in our community who have chosen hospice care for their loved ones. And what I am surprised about, probably most profoundly, is how humans step up for each other in any circumstance. I see it from families' perspective. I see it from the incredible nurses, chaplains, aides, volunteers. When people see pain, see suffering, see experience, see life, and go, I'm going to go sit and hold space with that. The amount of hope that those surprises give me on an ongoing basis is been extraordinary. And it is because I'm surrounded by people who have chosen to go ahead and talk about this part of our culture that we haven't been as comfortable talking about, which is death and dying and the process therein. So it just is incredible. I find.
I'm sorry, I talked over you. It's almost a supernatural thing that takes place. Looking back on it, it's almost as if that period is encased in this clear, filmy thing. You step into an alternate way of being when you're supporting a person that's dying, and people who never felt that they could do that before. They wanted their partner to be in the hospital. They didn't want to deal with any of the details. There's so many details that you have to deal with hospice. Found that they were heroic, and they look back on it and they're so grateful again for stepping up to the opportunity, but amazed by themselves. And then I think that they begin living life as if they are going to die too, and they will. I mean, they understand it more clearly, and they start doing the things that are necessary that they did for the person that passed. So I'm like, whoa, what just happened? That was amazing. It's my feeling about being with a person who's transitioning.
It's almost like filters are stripped away and you can just be real. There's less fear of reality. I know with my brother, we had conversations that, we never would have had if it wasn't for the fact that we felt we knew when the clock was ticking. And before that, we didn't. And I saw it happen with him and his wife, him and his kids, and making sure that we're getting filled up. But it was blissful. I mean, it truly was blissful. And it's what we carry.
And don't you think that has, I know that with my husband, and more so just because it was so personal, and also with my grandmother that was on hospice of the Foothills, but it reminded me how important it is to say those important things to people in real time and not hold it. And so I think that I am absolutely more honest and open, and if I want to tell my kids I love them, I say it all the time. Or friends.
My goodness, is that so true? It is, it was funny driving over here. I was talking to a friend on the phone, and we got into a bit of a thing over something we were talking about, and we were sending some thoughts back and forth, and I started laughing, and I just said, Tyler, I couldn't love you more, man. I couldn't love you more, because the truth of these relationships is there's such an opportunity to say I love you. And this work, the past 10 years of every, 5 days a week for me is I don't want to miss that opportunity, even when I'm arguing with my oldest best friend, Tyler, to say, man, I just love you, man. I don't get off the phone with anybody hardly where I don't say, that's in my circle, where I don't say I love you. It's my thing.
It's awesome. It's awesome. So I'm going to shift gears a little bit, and I want to talk about the importance of art and creativity and music. If we're navigating the end of life, but also for navigating the very profound experience of grief and bereavement. How have you seen this play out? Have you experienced it yourself? What are your thoughts on that?
Well, probably everybody's looking at me because I have the title artist. Artist. Yeah, which is so funny because being an artist just means simply being who you are. Like doing what you do is simply being who you are and being a nurse. Art pervades every part of my life. So this is an easy question for me to answer. Art creates space. So when you're so engaged with the dying, there are so many things that need to be done and said, and so many things that are important. But there's a way of connecting with the unseen through quietness, and the creative process helps you do that. Even if you stop with a coloring book or even listening to music and getting lost in it, you access another place, another part of yourself where, and this sounds a little woo-woo, you can access information that helps you in the journey when you're not creating. And imagery, when I led the workshop for the bereavement group, and then for your how do I call them? They're more than staff. What is the word? Your fellow employees at hospice. I saw them get lost in the imagery and go and deal with issues that they hadn't been confronting, being so busy with the work that they were doing. So art took on a personal level, as well as in regards, it took on great meaning it's in relationship to the work that they're doing with hospice. I can't say enough how important it is to be able to step out of reality for a moment, with music, with color, with moving a table in your room, putting a bowl of flowers on your bedside table where you sleep. Anything that just shifts you a little bit to be more aware of the beauty in the world. I hope I said that. It's just, I'm living this place all the time, so giving words to it is an interesting challenge. I'll have to think about it more often.
Goodness, I think so within us is so much inside of each individual, and art can be such a way of letting out that which is within us. And when art resonates, it's a love and hate relationship with my cell phone, but it's amazing when I'm sitting with a patient and they express an idea and I can pull up an image or a song on YouTube. And it's just a gentleman was sitting the other day talking about, you know, is spirituality something I'm creating, or is it real, or what? And I was able to pull up a painting called The School of Athens that has Plato and Aristotle in the middle, and one is pointing to the heavens, and that's where reality is, and one is holding his hand down. No, this reality, Aristotle says, is on the earth. It's just here. It's real. It was everything he was looking for. It explained all these things he was wrestling with right in front of me. And it was one image. And he instantly was like, oh my gosh, that's it. And I just think about that with music, and my goodness, with poetry. Poetry is their words, but in a sense, they're not words. They're so powerful, and they're communicating, and you can resonate with that, and they can pull such powerful feelings and thoughts out of us. Art is terrifically important. I mentioned Plato a second ago. I mean, his three ideals were the good, the true, and the beautiful. Well, the beautiful is about art. And all of these things, and these are core central things within us, according to Plato. And my goodness, if art isn't one of the more important ones,
Beautifully said. You who are not the artist, label the artist, but you have the soul of an artist. So.
You're awesome. Thank you.
Well, I would just add, I agree with both of you, and I just know that when a patient is going to be dying in the hospital, if we predict that or see that in their future, that we do have them bring pictures, music, flowers, anything that will create that space of beauty and comfort. I know for myself that it was interesting that you said that about flowers, because I've consistently done that since my husband died. Just, it's one more thing, even though I walk out in our beautiful community and I look at the sky every night when I'm walking out of work or I'm at home, and I don't have to go far to be reminded of beauty. And so I think that experiencing what we experience working with people that are dying, if you are going to nurture your soul and be able to continue to give, you need to look out for those beautiful things. It's just a way of taking care of yourself and then also seeing what's beyond you.
So as you guys were talking, I just it's like connecting to something outside ourselves that's inside ourselves as well. It's this interesting juxtaposition. And seeing what happens with the workshops that we have at work, seeing what I've gone through when I've gone to workshops where I would not consider myself a creative person, and then all of a sudden I'm somewhere else and I'm channeling my feelings and the emotions in a different way. It's a very powerful piece of our whole, and kind of like to bring it back home as we start to close out our time together. It really is, it's this piece of life that is everything. And we have sequestered it almost like sequestering art from life. Art is life, life is art. Death and life, they are congruent, they flow together. So for us who talk about it a lot, it's pretty easy. I'd like to end on the question of how would one who isn't surrounded by folks that have been talking about death for the last 30 years, how do you start a conversation? What suggestions might you have to a friend who maybe could use a conversation like this but doesn't quite know how to get it started?
I was just thinking, it's if I thought somebody could greatly benefit from a conversation around death and dying, and I wanted to breach the subject, and I thought it was appropriate and wouldn't be upsetting to the person, a very gentle way to begin it is to tell them, begin with something about myself and say, hey, it's just, I've been thinking about this, because you get in your conversation with people, and if it's somebody you're probably going to have an intimate conversation with, or you have in the past, and just begin it by slipping in, hey, I've been thinking about my advance directive, or I've been thinking about this, or I have another friend up the street who's dying and it just made me think about it. So you're not pushing somebody to tell me, well, do you have an advance directive? No. You can introduce the subject very delicately by saying you're processing, which I am. I usually am. It's somewhere in my mind. And I suspect most folks have it somewhere in there within them. And you can just offer it onto the table that you're thinking about it, and the receptivity clues you in to where you can go with the conversation. And if they say, gee, did you see the 49ers game? When you say that, well, you're being told we're not talking about this.
That has been my experience. I love the idea of death and dying. And I'm not exactly sure why. It comes very naturally to me. I think just, again, being that empathetic kind of person connected with unseen things and seen things. When I bring up lots of subjects with people, they bring up the 49ers.
Yeah, sure.
or they have to go.
Yeah, or they have to go
quickly.
Yeah.
So, this has nothing to do with it, but I liken it to talking about sobriety with a person who is an addict. You might as well just not say anything because they're not going to listen. That's been my feeling when I post things on Facebook all the time, and most people, I have a handful of people that respond positively about my talking about the afterlife or death, the afterlife question mark, I should say, and others just disappear. So I talk about myself exactly as you are saying, Greg. I talk about myself. And if somebody resonates with that, then the discussion continues. But otherwise, it's up to just being available, being present, listening, seeing if there's an opportunity. When I needed to tell Alan, who had dementia over and over again, that he was dying, sometimes when you're talking to people, that's a little bit what it feels like, is that there's just a way they just can't hear. But then there's a moment when he could hear. And I think there's a moment possibly when people can hear, when the ethers part, the air clears, whatever happens when people are willing to start dealing with what's right before them. So I love that. You said exactly what I would say if I'd had a college education.
Oh.
Well, I would say that, in my role, that is, I'm given, quote unquote, an assignment, and that I enter the room and have to start that conversation. And so many times I reflect on what is currently going on with them, and I find out from them and ask questions. So I'm exploring how they're dealing with news that they've been given, how they're feeling. If they are people that I have seen in the past, I will reflect on how maybe different they look. And so it is more of a compassionate questioning. And then that usually transitions into, we talking about advanced directive, talking about a physician order for life-sustaining treatment, weaving symptom management, because that's my role, into that, and really talking about what fears they have. So it comes naturally. I think my family probably knows what I'm doing when I'm talking to them, and they know the nurse talk, but it is not a hard conversation for me. It is difficult for certain people that just don't want to, and I have to respect that if you don't want to talk about it. But there's usually that window that will open up, and we can have a good conversation about what their wishes are and how they feel, what they've heard from the doctor, and what does that mean to them.
I just want to say thank you. I am almost dumbstruck by the gratitude I have that I am surrounded by friends like you, Lauren and Gregory and Mary Lou, that we live in a community, that we provide care, and care, whole person care at the deepest level, and that there are folks like you out there having these conversations. And I love you.
Mm-hmm.
And we
Love you back. Big time.
Okay.
Yeah.
Okay. Thank you. This has been a great conversation. We're going to pause right now, and we're going to pick it up again for part 2. Thank you again.